This video is going to ruffle some feathers. There are things that everyone with a herniated disc should know. This is important because it helps you take better care of your disc, helps with healing, with treatment, and prevents it from getting worse, prevents the hernia from getting bigger. In this video, I'm going to give you all the guidance that I give to my patients, including telling you what is already outdated, what is no longer used, and explaining important points, points that still today cause friction between doctors and physical therapists. I'm going to cause trouble with this video.
This guy is crazy.
This video is divided into chapters. You can skip ahead or go back to any part you want. Deal? Let's start by talking about those more obvious guidelines that almost everyone knows. But it's important for us to mention them because there's always someone who got bad advice. You should drink plenty of water throughout the day. Hydration is important because the discs in our spine work like a sponge. When we're not compressing the discs, when we're lying down, resting, the discs absorb the water that's around them. They stay hydrated and they need this water to stay healthy. When we don't drink a lot of water during the day, when we don't hydrate enough during the day, the discs can't get hydrated and they get sick more easily. In other words, without water, you'll have more herniated disc episodes and you're more likely for the hernia to get worse, for the hernia to increase. Then you ask Dr. Alexandre Mota, how much water should I drink? What's the ideal amount? There's no magic number here. A lot of people say that we have to drink 35 ml of water per kilogram of body weight. If you weigh 100 kilograms, you should drink 3.5 liters of water. But I think it's much easier, much more practical for us to develop the habit of drinking water. Always carry a water bottle with you and take a few sips every 15 minutes or at most every half hour. You can set an alarm on your phone or watch. When the alarm goes off, you take a few sips, drink however much feels good and comfortable to you. In a very short time, you'll see that you won't need the alarm anymore. You'll start to feel the need to drink water. And this will make an incredible difference at the end of the day. And in how often you feel pain. You'll see that you'll feel pain less often. It's true. Regarding physical activity, our spine needs movement to stay healthy and to help improve and even heal a herniated disc. So the general rule is start or keep doing the physical activity you're doing with proper supervision from a qualified fitness professional. When you're doing a pain flare-up in that acute phase, in the phase of greatest pain, in the worst phase, it's okay for you to stop for a few days. But as soon as the pain decreases, you go back to your weight training, to your physical activity. A qualified fitness professional will know how to adjust and tailor the exercises for you. Usually we go back with half the weight we were using, and as we feel better, we progress safely. Don't worry. It's not like you're going to lose half of your progress. You'll come back safely, and you'll see that you'll get back to where you were before much faster. Now, for those who don't exercise yet, it's important to start. And people always ask me, Dr. Alexandre Mota, is walking good? Can I go for a walk? I recommend choosing a more dynamic form of exercise, one that gets your spine moving more. Think about this. Dos discos. Our spine needs mobility, movement in the joints, and strong muscles to relieve pressure on the discs. So walking is not that good. It's not ideal. It's not as good as weight training, Pilates, water aerobics, dancing, or swimming, which are activities that move the spine in different ways. When we walk, we move very little. It's almost just the same repetitive movement. Now, if you don't have the means in your city to do a well-guided, well-supervised physical activity, and if walking doesn't hurt your spine, on the contrary, it makes you feel good, makes your back feel lighter, then you should walk. And here we go! Anyone with a herniated disc knows that the morning is the worst time. It's the time when the pain is worse. It's when your back tends to lock up more. It's when that feeling of an injured spine increases. Remember when I told you that the discs work like a sponge, that they absorb water and get fuller when we lie down, when we're resting? So in the morning, when we wake up, that's when the disc is at its highest. It's the fullest. So it's much easier for it to compress the nerve that's already irritated. The best thing we can do is prepare the spine to start the day. It's like we're going to grease or loosen up the spine to avoid that pain, that stiffness that usually happens in the morning. There's a routine, a sequence that I've been teaching my patients for years. You're going to start by lying on your stomach. Turn slowly, take your time, and get into a position that's comfortable for you. In this position, you'll stay for 30 seconds, breathing more slowly. Feel your breath, relax your spine, and create space. After 30 seconds, prop yourself up on your elbows. Keep breathing, and you can also move your head up and down, looking forward and looking down. This will help not only your lower back and thoracic spine, but also your cervical spine for another 30 seconds. Lastly, you're going to do this movement. Look, place your hands at shoulder height. Let your feet hang off the bed. Relax your spine and stretch your arms as far as is comfortable for you. Stretch and return. You're going to do this for another 30 seconds, or you're going to do it 10 times. These three movements are more than enough for most people to avoid flare ups, locking up, and that discomfort, that feeling of an injured back during the day.
I loved it. Whoa, this is where the debate starts.
A strong spine isn't that, and it doesn't get stronger like that. A strong spine is one that has support, that has stability. The muscles that really protect our spine are much deeper. They're actually closer to the spine itself. To be clearer, these muscles move the spine. These muscles protect the spine. And not knowing this causes a lot of people to have back pain, flare ups, worsen their herniated discs, and give up physical activity. And if you don't have a good fitness professional or a good Pilates instructor to help you with this strengthening, I've already made some videos showing how to strengthen your spine at home. It's a series of videos that I'm linking it here in the card, and I'll also put it in the description to help you. All right? Of course, it used to be said that people with a herniated disc shouldn't wear high-heeled shoes because it puts strain on the lower back. And especially not shoes with little cushioning to protect your spine from impact. But that doesn't make much sense. First, because for many people, wearing heels or shoes with a higher heel helps maintain the normal curve of the lower back. For these people, wearing flat shoes increases the pain. So if you work standing up, like if you're a salesperson, for example, and if you wear flatter shoes, that causes you more pain. How am I supposed to tell you to wear something that causes you pain? So you can wear heels or shoes with a higher heel if that makes you feel better. But understand that it's like a crutch. Tao. As your spine gets better, you'll be able to wear flatter shoes. And that's when it's time to switch shoes. Second, impact helps strengthen the discs. There are many studies that show that the spinal disc of runners, people who run, are much stronger and healthier. Besides that, shoes or sneakers with a lot of padding, a lot of cushioning, very soft. For many people, don't give a sense of firmness. I'm one of those people. When I wear very soft shoes, it gives that feeling of walking on clouds. It feels like I'm stepping on a mattress. And automatically, our body acts as if it's trying to balance itself. The posture changes and the muscle tension changes. They are ready to spring into action, to act at any moment. So remember to listen to your body and look for shoes that make you feel good, that reduce the pain you feel. Shoes are meant to give you comfort. It's like the saying goes, right? Only you know where the shoe pinches.
I got the reference.
Especially people who work sitting down need to take breaks. Ideally, you should work for 25 minutes and take a 5-minute break. At most, work for 50 minutes and take a 10-minute break. A lot of people know this. But what I don't see many people talking about is that this isn't just any break. It has to be an active break. It's not about getting up from the computer and sitting on the couch. So during the break, stand up, move around, fill up your water bottle, and do these two movements. Up. Place your hands here behind your back at the level of your lower back. Preferably, your fingers should touch each other without bending your knees. Lean back until you feel that nice stretch in the front of your spine. Go back and forth. You're going to do this 10 times without forcing it. It's just to get the feeling of stretching without pain, the sensation of a good stretch. You've done it 10 times. Sit on a chair. It can be a firmer chair. The important thing is that your entire spine, from your buttocks, from your sacrum, all the way up, is supported by the backrest of the chair. Interlace your fingers behind your neck. Bring your elbows forward and simply lean back. You'll feel your neck stretching. The thoracic spine and even the lumbar region. Go as far as you can stretch. Hey, that feels good. And come back. Do this 10 times. This is important to decompress the entire spine, relieve muscle tension, and also ease the strain and tension on the ligaments. Each one is better than the last. In the past, people used to talk about the right posture. You have to sit like this all the time. You have to lie down like this. You have to sit like this, stand up like this. But what I hear people say the most is, Dr. Alexander Mota, if I sit like this, that's when the pain starts. Or Dr. Alexander Mota, if I lie down like this, I can't sleep. Or I even try to sit and stand up this way. But if I do it like this, my back locks up. I've already said that our spine needs movement. So it's not about staying in just one position. It's about changing positions from time to time. That's what's natural, physiological, and normal for our body. If you watch people in a line, for example, you'll see that everyone will change positions. They shift their weight from one foot to the other, turn a little to the side, move a bit, lean on the shopping cart. Or when we're sleeping, we change positions several times during the night, automatically without even noticing. So here the rule is, sitting down, you'll make small adjustments. Sit a little more forward or a little more backward. Cross or uncross your feet. Rest one elbow or both on the table. Make these corda músculos de fé, because that will bring change, improve how your body is supported, give your discs a break, improve your joints, and also wake up different muscles. This helps reduce that pain at the end of the day. When it's time to lie down or get up, do it in the way that hurts you the least. Even though turning to your side, putting your feet out, sitting up slowly with the help of your arms is what works for most people. You can adapt, change the order, and do it in the way that feels best for your body, the way that hurts you the least.
Now I get it. Now I understand.
Huh? Another thing that a lot of people give wrong advice about is sleeping position. And look, sleep quality is extremely important for our spine. It's during sleep that the spine rests, the discs get hydrated, nourished, and repaired. And then come those outdated tips. You have to sleep on your back without a pillow under your head, with a pillow under your knees, or sleep on your side with a pillow under your head and another between your knees, or you can't sleep in a hammock, you have to sleep in a bed. People used to say that thinking only about spinal position, as if you had to sleep with your spine straight. But first, we move around when we're sleeping. So, for the vast majority of people, trying to control the position you fall asleep in is a waste of effort. Because when you fall asleep, you're going to change positions. Second, what matters most to us is the quality of sleep. For our spine, what matters is the quality of sleep. So the rule is, focus on sleeping in the most comfortable position for you, whether it's in a bed or a hammock. Focus on sleeping in a way that helps you fall asleep faster, have deeper sleep. Wake up less during the night and wake up feeling refreshed and energized. A very important tip, especially for those who have a herniated disc, is to take 2 minutes before going to sleep to do some movements that release all the tension accumulated during the day, which builds up in our spine. This will help you fall asleep faster, help you have deeper sleep, and might even help you wake up without. I show you how to do it in this video right here. Just click here on the screen. And if I managed to help you today, if you learned something new, share this video with someone who has a herniated disc. That's all I ask of you. Make sure this video reaches those who need it. That's it for now. Take care and see you next time.